rise for the pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first item is a motion to recess the Commissioners' meeting to hold a retirement board meeting.
Motion.
Second.
Motion and second, all in favor? Aye. Motion to call the retirement board meeting to order.
Motion.
Second.
Motion and second, all in favor?
Aye.
Motion to approve the May 21st, 2025 agenda.
Motion.
Second.
Motion and second, any questions? All in favor? Aye. Motion to approve the April 16th, 2025 minutes.
Motion.
Second.
Motion and second, all in favor? Aye. Motion to approve the refunds of contributions to employees no longer with the county. There are 7 individuals listed.
Motion.
Second.
Motion and second, any questions? All in favor?
Aye.
Motion to approve the following retirements. There are 2 names listed.
Motion.
Second.
Motion and second, all in favor? Aye. Motion to approve the following invoices for payment. Corn Ferry, $5,627 for the first quarter actuarial services. Beyond Investment Advisors, $57,944.66, first quarter fee billing. Broadridge Matrix Trust Company, $13,220.45, first quarter assets transaction.
Motion.
Second.
Motion is second. Any questions? All in favor? Aye. Motion to adjourn the retirement board.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to reconvene the Commissioners' meeting.
Motion.
Second.
Motion is second. All in favor? Aye. Okay, do we have any public comments or questions concerning today's agenda?
I have a public comment. My name is Kevin
Does it have to
Holden.
do with the agenda?
Yes.
Okay.
It relates to proclamation on mental health. I can either present my comment now, or I can hold it off until the end of the meeting. Whatever respectfully the commissioner desire. But it's definitely regarding the proclamation and how it's worded and written as it relates to civil rights.
Probably most appropriate
Yeah.
to comment after we read the
Can we read it?
proclamation.
And you can point it
Okay,
out.
will do. Thank you. With respect.
Any other? Okay. Motion to approve the May 21st, 2025 agenda.
Motion.
Second.
Motion is second. Any questions? All in favor? Aye. Motion to approve the May 7th, 2025 meeting minutes.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the May 14th, 2025 conference minutes.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve payment from the general fund of county bills in the amount of $966,626.95.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve payment from the bridge repair account in the amount of $184,835.98.
Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the payment from Act 8 in the amount of $8,700.
Motion.
Second.
Motion is second. All in favor?
Aye.
Old business, motion to award bids for the tri-annual groceries and frozen food bids for the period of July 1st, 2025 to October 31st, 2025 on behalf of the correctional facility to Medilla Foods in the amount of $93,215.95, Driscoll in the amount of $22,642.58, Cisco in the amount of $14,523.81, Bernard in the amount of $17,313.74, and Foods Galore in the amount of $81,505.70 for a total bid amount of $229,202.78.
Motion.
Second.
Motion second. Any questions? All in favor? Aye. Motion to open proposals for the Strategic Management Planning Program.
Motion.
Second.
Motion second. All in favor? Aye.
6 bids. So we've got first one from Pennsylvania Economy League, which has a flash drive containing all proposal information, cost fee information, and 5 separate envelopes labeled technical proposal. Open cost fee information. There are 5 copies here, so I'll spread these out first. Given how many of these there are, you want to go through each one of them rather than open them all and
I think what we're going to do anyway is we're going to, we're going to open them.
Yeah, clearly.
And then table all of this until we have time to review them all. We're going to be reviewing this with, tell me his name again, I'm sorry.
Jonas Kratz from DCED.
From DCED, who will help cost effectively.
Okay.
These are RFPs, so there's,
Right.
And it's just,
So,
what will happen here is it will determine on how much we want to use their service, because that's what's in all of these, is, there's lots of different options. Right?
Yeah, right. That's how it's structured in terms of how also percentage points of the project completion and payment occurs.
So we would just state the vendor and if there's an amount.
Yeah. Okay. So then the vendor again is Pennsylvania Economy League, and the total amount of compensation is $196,750.
Hopefully they've all put them in envelopes like that.
Yeah, it might make it easier. Okay. The second one, that's probably the better idea. Let's do it that way. Okay. All right. Second is from HRG, and there's a binder entitled Technical Proposal. Letter of transmission. There is a flash drive that accompanies this, so I don't know if that is where the bid information is contained. This appears to
It's in a separate envelope.
It's in a separate envelope.
I think it's the next one.
I'm sorry.
Thank you.
Sorry.
Okay. I thought there was
You're scaring me.
a different bidder.
No, same one.
All right.
That
I
was
should have seen that there was HRG on this
Yeah,
one
I'm
as
sorry.
well.
Yep.
Okay, so let's open that. Okay. Here is the price proposal. Indicates we propose to complete the work outlined in the technical proposal for time and materials not to exceed a fee of $138,000, inclusive of an estimated $800 in out-of-pocket expenses. Is that the accurate?
Yes, sir.
Okay.
Thank
All
you.
right, so we have HRG.
Okay.
Strategic Management Planning Program, Cafferlin Strategies is this bid, and there's 2 envelopes here. One entitled Compensation Proposal, and the other one is a Technical Proposal. We'll open Compensation Proposal.
Heffernan Strategies commits to not exceed the total amount of $108,850 in consulting fees, estimated out of pockets are $16,075 for a total of $124,925. This is from
These are bids for the Strategic Management Planning Program. Can you explain a little bit about what that is exactly?
we open.
Yeah, open away.
Right.
That's not why you're open.
Okay.
You had a minute to explain. That's
All right. So this one is from Susquehanna Accounting and Consulting Solutions Incorporated, and the estimated cost, all-inclusive maximum fee of $83,040. That's two envelopes, the pricing proposal and the technical proposal. Oh, and there's actually a third with the bumper drive. Last, the fifth, I put six before, but I counted twice, is from Raftlis, R-A-F-T-L-I-S, Financial Consulting. There's a thumb drive, financial plan. Looks like the spiral bounds have both the financial and technical. Oh no, here's the price proposal. Compensation outlined here is a total of $177,400, which includes professional fees and expenses, including travel.
So this,
I have one quick question. That was a bid that just came into our office. Are we allowed, it's after 11 and
Well, we're opening, I mean, was there a bid deadline?
11 a.m. this morning.
How did it get to the office here by 11, or did it?
It just came up from the mailroom. I didn't check.
Well, if it was in the mailroom, it was received by the county, and so I guess the 15-minute delay in transmitting it upstairs is, maybe we should open that bid.
He was here when I got here. So the man was
There
here.
you go. All right, so there's six after all, there you go.
so we're waiting for that. So this is just as it's called, a strategic plan for us to do a study on our finances in the county. This was recommended by DCED. As we've explained before, we went through some struggles with our budgets, and this is to hire a consulting firm, which many counties do, it turns out, to just go through and analyze all of our departments, see where there's places that maybe there's some places to save some money, but also analyze what we need to do. And one of the examples is analyze what we need to do as far as a reassessment, because that's part of the whole, maybe part of the plan is the solution of what that looks like. And then also just go through every department, analyze contracts that we have, and to just help us go through all this, besides just doing it in-house. The state pays for, well, it depends on how we qualify for this, but the most we would be on the hook, I think, is like, well, we're thinking like it's 10%. So when you see these numbers, the county is gonna have to put some money in here, but it also can be used with in-kind services, because there will be some work that's gonna be done within our finance department to do this, so. We'll wait for this bid to come in.
Actually, the mailroom was mistaken, it's not a bid.
Alrighty, so the mailroom is mistaken, okay? So with that, what I would suggest is, because as I said earlier.
So the other thing, important part of this is they're gonna provide advice on whether we should restructure some of the debt and looking out into the future to provide us with a plan going forward.
Since we're all speaking, I will also add that I think, to the credit of this office, we are being extremely proactive when it comes to finding a resolution to prior struggles that some were beyond the office's control, right? And some just require just a closer look at how we structure our day-to-day tasks in our finance department. And now we have someone new at the helm, and we look forward to working hand in hand with the state, who has had this program in place. Many counties have taken advantage of this, and hopefully we will do the same and bring some positive results for the residents of the county.
So this is somewhat of a reaction to the downgrade that happened several months ago.
It is, yeah. So with that, as I said earlier, we're going to have these reviewed with DCED and us, and there will be interviews of the firms so that we can feel comfortable with them. So I would suggest that we table this, awarding of this, until the June 4th meeting. I need a motion to that effect.
Motion.
Second?
I have a motion, I have a second, all in favor? Aye. Okay.
Five
Not
total.
six.
Yes, not six.
All right, thank you.
We got back to 5.
Okay, next we have is a motion to open the bids for the Bennett Avenue paving project. I need a motion.
Motion.
Second.
Motion and second, all in favor?
Aye.
I was just looking at this gentleman. You're welcome to leave unless
Oh,
you
no,
want to
I-
stay for all the excitement.
No, I enjoy public meetings.
Okay, all right.
Yeah. I've been doing this for everything.
There's mental health awareness month.
That's right. That's good. I'll be seeking counseling later. I'm just kidding.
Yeah.
Yeah. One bid here from Lindy Construction, and it appears bids and then there's unit price bids. The lump sum bid total is $208,600. But then there are,
I believe there's a number of options.
there's some options. There's unit price bids is roadway sub-base, 50 tons, $75 a ton for $3,750, $3,750 total. And contingency items totaling $33,750 with a lump sum allowance of $25,000. Out here, total bid amount $271,100 is the total.
Okay, so the same thing with this bid, we will table this and have it reviewed by the engineer for clarity, so we can make a motion to table until June 4th. I have a motion, I have a second, all in favor?
Aye.
So carried.
Sorry, question over here. That's to pave all of the area around Bennett Avenue?
Yeah, and that's why the numbers of what Jason was reading is, we didn't know where it was gonna come in, so we have blocked out different areas, but that is the plan, to pave everything around that building and some, because it all depended on the amount of money that we have. We were awarded a grant by PennDOT to do this, and I don't know off the top of my head the amount that PennDOT has given us, I've forgotten, but that's why we awarded it that way, because we didn't know where it was gonna come in.
So that'll include like the stuff in the back and then the.
Some in the back,
front.
yeah, not the entire property. I mean, it's a massive piece of property. Way down in the back there is probably not included. But around the building that you know of, and in the front and the sides, yes.
Okay, thank you.
Okay, so I need a motion to open proposals in order to coordinate and provide effective service delivery to eligible older adults and disabled persons in Pike County on behalf of the Area Agency on Aging.
Motion.
Second.
Motion and a second, all in favor?
Aye.
This is from Dongy Home Care, DONGY, and proposal for a unit cost of $20.25 per hour.
Okay, so again, we'll have these reviewed by the Area Agency on Aging, so we need a motion. To June 4th again.
Okay, second.
I have a motion and a second. All in favor?
Aye.
Okay, that's complete with that exciting part of the meeting. New business, motion to adopt resolution number 2518, Mental Health Awareness Month, May 2025.
Motion.
Second.
Motion and a second. All in favor?
Aye.
Krista, could you read that one?
Sure.
Please.
Resolution number 2518, Children's Mental Health Awareness for Mental Health Awareness Month. Whereas good mental health is a key component in a child's healthy development, and Mental Health Awareness Month shines a light on this important matter. And whereas since 1949, the organization known as Mental Health America has observed the month of May as Mental Health Awareness Month, and it is time to call for action beyond awareness, to be proactive in responding to the needs of our children and adults. And whereas it is important that children and adolescents, along with their families and communities, learn the signs of behavioral health challenges and where to obtain assistance and treatment in their home communities. And whereas obtaining a full and accurate diagnosis of a child requires gathering information from diverse sources, including the family, school, and others involved with the child. And whereas the involvement and partnership of family members in the assessment and treatment of children and youth is essential to positive outcomes. And whereas in 2006, the National Federation of Families initiated Children's Mental Health Acceptance to focus on the acceptance of children with mental health diagnoses. And whereas children and youth with the most intense needs are frequently underserved and experience inequities in access to support and needed treatment options, which in turn contribute to a social justice issue for youth who experience mental health challenges. And whereas addressing the complex mental health needs of children, youth, and families today is fundamental to the future of our nation and to Pike County, Pennsylvania. Therefore, we, the Commissioners of Pike County, Pennsylvania, along with Carbon Monroe Pike System of Care and Carbon Monroe Pike Mental Health and Developmental Services, do hereby proclaim May 1st to 31st, 2025 as Mental Health Awareness Month, and urge citizens and organizations to work toward meeting the mental health needs of every child in Pike County, Pennsylvania, and unite to promote acceptance of children with mental health issues and their families.
Thank you, Krista. So we have a representative here from Carbon Monroe Pike. Would you like to say a few words?
Sure, yeah, I'd love to.
Thank you.
Thank you so much for the recognition and the honor of being here. We certainly want to make sure that we're teaching many people how to express themselves and to seek services and supports. And this year we challenged our young people to really be creative and express their desire to seek mental wellness. And we were able to get some artwork that was prepared for them. And I certainly would love to have some of it on display. Oh, here's one piece, and I have a few other pieces with me. Let me just pull out some representation. But young people really are passionate about their own health. And so here's another example. They're really passionate about their own health and want to be part of solutions as well. So we do encourage all of that, and we hope that our youth continue to invest in themselves and continue to make sure that they are aware of where they can turn to and get the support of their community. So thank you so much for the resolution today.
Thank you.
Thank you.
And I'll just put these up so if anybody would like to view them.
Just let us know your name.
Yes, Larissa Kimmel. I'm the System of Care Coordinator with Carbon Monroe Pike Mental Health and Developmental Services.
Thank you, Larissa.
You're welcome.
Anyone have anything to comment? No?
I think I'll keep the peace.
Okay.
No comment.
Okay, next we have a motion to adopt resolution number 2519, National Emergency Medical Service Week, May 18th to the 25th, 2025.
Motion.
Second.
Motion is second, all in favor? Aye. Ron?
Resolution number 25-19, Emergency Medical Services Week, May 18th to the 24th. Whereas emergency medical services is a vital public service, and whereas the members of emergency medical services teams are ready to provide life-saving care to those in need 24 hours a day, 7 days a week. And whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury. And whereas emergency medical services fill healthcare gaps by providing important out-of-hospital care, including preventive medicine, follow-up care, and access to telemedicine. And whereas the emergency medical services system consists of first responders, emergency medical technicians, paramedics, emergency medical dispatchers, firefighters, police officers, educators, administrators, pre-hospital nurses, emergency physicians, trained members of the public, and other out-of-hospital medical care providers. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and accomplishments of emergency medical service providers by designating the Emergency Medical Services Week. Now, therefore, we, the Board of the Commissioners of the County of Pike, in recognition of the 51st anniversary, do hereby proclaim the week of May 18th to the 24th, 2025 as Emergency Medical Services Week, and encourage the community to observe this week with appropriate programs, ceremonies, and activities to profession and essential services it provides.
Thank you, Ron. And Tim
Sure.
is a Director of Public Safety in Pike County, and I think I have a few words about this. The Commissioner's Office is continually in support of our EMS and all of our first responders. So Tim, you want to give us a little update on what's been going on? And
Sure. Thanks, Commissioners. You know, I have a lot of concerns in the morning when I wake up. Our EMS system here in Pike County is not one of them. And that's with all the hard work from our local residents to our businesses to our county commissioners to our municipal officials. I remember the days when we used to wake up and find stuff like this. You know, studying Berks County finds EMS systems in crisis. You know, we've been saying this for 5 years. You know, with the help of the commissioners and local municipalities, we fixed the problem. And, you know, just as an example, we have, I told this before I came down this morning, we've already answered 4,990 EMS calls in Pike County this year. Almost 5,000, not one failure, not one scratch. I mean, the system's fixed, the system's strong. We keep adding to the system, and we can't do that without the help of the businesses and the commissioners and the municipalities. But I just want to commend our EMS agencies in the county because they're awesome. We don't hear too many complaints about anything. They get the job done and the system's fixed. And I just wish the rest of the state would step up and meet that need because this is an everybody problem. It just isn't one problem. But it's one problem we don't have to worry about. So. Few of the things that, you know, our training's ongoing. We're always trying to increase our services into the system. Last year we added AEMT, which is the advanced EMT that can start a line, you know, give an IV, do some other stuff. So that's important. That's mixed in. I would say probably half of our EMS agencies in the county now run some type of A unit. So we're advancing forward. We're never slowing down. Training is optimal. I mean, we hit on the training real hard. We've done a lot of work. Our last EMT class right now, few of them have to test yet, but we're 9 out of 10. That's well above the state average. I mean, so we figured that out and we got that. But just couldn't do it with all the help from the commissioners and municipalities and local businesses.
yeah, I think it's important that we recognize that, you know, it's not just the commissioners, not just the township, but it's also the community. You know, so I'll just, and Jason can chime in here. So just this week, we had a fundraising effort to fund what we call the Pike County Initiative Training Fund. It's a really long acronym.
I can't figure it out. I have to look at my notes to write
Services Initiative.
Yeah, I don't know who thought that up.
Which
It's quite
It was a good
something.
moment for us.
But the important part is that fund has continued now for a number of years through the efforts of Mr. Oliger and others in this community to fund a system where anyone in this community, and we say this all the time because we urge people to sign up, anyone in this community that's looking to be trained as an EMT would go to our training center, and it's at no cost to them. What's cost to them is their time and energy into this because it's not simple and it's a lot of work. but through Tim and his staff up there, we are training people every month, every quarter, I would think it is, and they're serving our community. I met a young man the other day at the golf outing who just finished the training and he's on a career path to be an EMT. So it's more than just volunteers, and we truly appreciate all of our volunteers, but at the same time, we need to think about how this system can be resilient, and the way to do it is to make sure that we have paid staffs. I'll let Jason speak a little bit about the golf outing, because it was another great success, and it brought a whole pile of people out to show support for EMS in Pike County.
Thanks, Matt. So we had our second annual charity golf tournament for EMS. Last year we ended up raising a net $15,000, which we then donated. We had a couple more golfers last year. We had some last minute cancellations. We had a couple fewer golfers this year. I guess people didn't want to come out on a 65-degree sunny day and golf. I don't really know what was their issue, but we had more sponsors. So I think we're going to net out about the same. I'm going to have a final tally probably by next commissioners meeting as to what the donation from that will be. We have some expenses that still need to come in and things like that, but it should be very comparable to last year. And if we keep growing that fund, I think that the balance of it keeps increasing. So we're making money faster than we're spending it, which is a good thing. I think Tim can probably speak firsthand to whether or not that's provided success in terms of training. And I mean, is it covering all of the expenses, even of the new AEMT?
Yes, it is. Yeah, it definitely is. It's covering all the CPR and the first aid classes that we do for the responders throughout the year as well. I mean, it's really. We always said when the EMS crisis, you could throw as much money into the system as you want to, but if you don't have the staff to fulfill it, it's no good. So, not only do I feel like we fixed the problem, we also created opportunity for our local residents and our youths coming out. I mean, the CTE class that we have at the school, and I hear East Stroudsburg's coming on in 26, 27. But that, just the CTE class, I mean, when they get done with their senior year, they do it their sophomore, junior, and senior year. When they get done with their senior year, the sky's the limit. I mean, they have all the requirements. They want to be a firefighter, they got that. They want to be an EMT, they got that. I mean, so the opportunities that we're providing is just unbelievable for these kids. And, I wish when I was young, those opportunities were there, because it's just endless of what they could do or where they want to go.
I think the comment that came out of your office was we're stocking the pond.
Yes, we always stock the pond.
There was some terminology like that.
Today's used. I was just telling somebody the other day, when I was young, and you figure out what you want to do and you stay with that job for 30 years. That's not today's youth. Today's youth is looking at the next opportunity, so you got to keep stocking the pond.
Yep. Right. And I think it's important to note that I think you were giving me that report I spoke the other day at the golf room. It's $1,050 per student to get.
Yeah, that's low end.
So that's a lot of money to ask somebody in this community to outlay out of their own pocket for. That this fund is contributing to towards their education.
Yeah. And we do the legwork for them for all their labs. Like, we get all the connections with the EMS companies so they can do the ride-alongs. EA is a lot of skill involved in that. So we have agreements with Lehigh Valley, Wayne Memorial, where they could go do their lab stuff in their emergency room. So the groundwork's laid out there. It's just, they have a tremendous amount of, time commitment ahead of them to achieve this, and we've been pretty successful.
So what you did the other day is you trained 15 more.
Yes,
Think
you
about
did.
that, right? So,
Well, I didn't do anything. The only thing I do is I raised some money for the fund.
Whatever, but
and you guys and Tim and the volunteers who are giving their time, they're the ones who make it work, because raising the money is just step one.
I thought your name was on the registration for next class.
So I segue into, remember, make a donation to the fund. It makes a difference in our community. No matter what the amount is.
No, I was just gonna say, I would be remiss, certainly I applaud all of the work that's done in this county on behalf of our EMS workers and training our amazing young people to become, our next heroes in our EMS field. But I'm hoping, and I've said this privately and I'll say it publicly to our residents, I would love to, and I know once we get through this strategic management planning program, hopefully we will find a way to benefit our fire departments in the same manner or a similar manner, because certainly they could use the help, and my colleagues.
We are using some of the fund, like they would have to pay out of pocket for CPR and, bloodborne and, mandatory reporting. So we are using some of that fund for that stuff as well. I mean, not a lot of it, like EMS is a big dollar thing, but there is some stuff that we are doing to accomplish it.
Yeah, a dedicated fund would be great, so hopefully we can make that
And
work.
I'd just like to add, we have an exceptional leader in Tim Knapp, and he's known throughout the state, and I believe our EMS initiatives are leading the state and are recognized around the state. We hope that that spills over, because we are doing such a good job with it right now. We are spilling over state and county lines, and that is a burden on our system that we hope others follow the same path that we did. And a special thank you to Jason for his leadership and initiative for not only starting this initiative, but continuing and being steadfast with it each and every year. It's exceptional to see good inter-county businesses contribute to such an important thing. Thank you.
Thank you, Jason. I'm not a golfer, but if you do a bingo, I'm there.
I think, Chrissy, you brought up a nexus between strategic planning and
You can
finance.
step over here if you like.
Kevin Hollian, Damon Township, on the subject of strategic planning and EMS. I'm hoping that when the county and commissioners review 5 documents, that they use some of the principles and concepts within emergency management, more specifically risk management, the concepts of risk avoidance, acceptance, mitigation, remediation, where prior to that, you define your critical business processes and identify what's mission critical, non-critical, essential, non-essential. Not only the work processes, yet as well the personnel. So I'm hoping that the county sees the marriage or the need to blend certain activities, terminologies, and principles to engage policy from a financial standpoint. Already, the commissioners respectfully are doing a great job in managing the budget. I think a lot of the citizens understand that based on minimal zero increases in taxes. Yet, when you're engaging outside contractors, if they're solely looking at things from a financial stovepipe, they may not look at the marriage that a finance department has with risk management. So we're blessed to have Director Knapp, and I'm hoping that he's well used in this dialogue on the strategy. Thank you, sir.
Thank you.
Okay.
Now that was asked Tim a question.
Sure, yeah, go ahead.
So Tim, you've got a unique program here at the county level that we talked about the differences between where we were and where we are now. Can you go into a little bit about response times, where they were before the commissioner's plan came into play and where they are now?
Well, I won't get into the numbers, I don't have them in front of me, but a lot of our response times prior to the plan that we have in place right now is we would waste so much time trying to find an ambulance that was available. That's not the case anymore. We didn't get the first quarter numbers done yet, but once I get the first quarter numbers done, you'll see that your EMS, when you call 911, your ambulance is on the street within 3 minutes heading to you. Now, response times vary because they could be going a mile, it's my county, they could be going 20 miles. So they vary, but we always look, when we review CAD notes and stuff like that, we always look, okay, what time were they on scene? Okay. Or what time they respond, what time they're on scene. How long did it take them to do their assessment? How long did it take them to get to the hospital? And how long did it take them to get back in service? And having such a robust plan allows us the fact of, if ambulance A is out on a call, ambulance B is stepping right in. It might be a little bit of travel time difference for ambulance B to get there, But there's, we had the domino, when you talk about risk management and stuff, that's all part of our plan. Hey, what if these 2 ambulances are out? Okay, the third one's going. There's no delay in dispatch saying, okay, are they available? Or this one available? It's responding already.
But with people, with EMS services being paid now, people being in-house, so a call comes in, it's not a volunteer getting up from their kitchen table and having to go get their ambulance and then go to the location. Can you talk a little bit about that?
Yeah, that's what I was trying to hit a little bit earlier. Like when, prior to this commitment, we have some great volunteers, don't get me wrong, but they have to get up from their dinner table or out of their bed, to the ambulance building, start the ambulance up and drive to the scene. Now, that same ambulance, you might have took that 10 minutes, 15 minutes, I don't know how far you live away from your station, that same ambulance is on the street within 3 minutes. There's no delay with that. I mean, it's 3 minutes. And our CAD system is very in-depth. We know if that ambulance is out, the CAD tells us to call this ambulance, and the CAD tells us to call this ambulance. I mean, there are days that, in the summertime, you get to the southern county where you get a lot of people in, where the 2 or 3 primary ambulances here will be on another call. We just get one of the northern units to come down. I mean, that's just the way we do it. It's a pretty, we thought about all that with risk management when we put this plan together, and the system works, but there's no delay in service of getting out the door.
Thank you very much.
Okay, what else? Okay.
This.
Good. Yes, go ahead. Are you speaking to this?
Oh, no.
No, let us finish the agenda and then we'll get to public comment. That's
I'm
okay. That's all
so
right.
sorry.
I figured you
Don't be sorry. We're just going to rattle through
Thank
the
you.
next
No,
one.
I'm sorry.
But these are really exhilarating.
And I was late for a reason, just so you know.
Motion to authorize the chairman to execute the agreement for services between RealAuction.com LLC and the County of Pike on behalf of the Sheriff's Office. Motion.
Second.
Motion is second. Any questions? All in favor? Aye. Motion to authorize the chairman to execute the Pennsylvania DEP 901 Municipal Waste Planning Grant Disbursement Request Form. Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the Human Services Fair Grant Payment Voucher in the amount of $1,867.50 on behalf of the Office of Human Services. Motion.
Second.
Motion is second. All in favor? Aye. Motion to approve the Pike County Home Program Payment Voucher in the amount of $58.75 payable to the Recorder of Deeds on behalf of the Office of Human Services. Motion.
Second.
Motion is second. All in favor? Aye. Motion to authorize the chairman to execute the Housing Rehabilitation Assistance lien on behalf of the Office of Human Services. Motion.
Second.
Motion is second. All in favor? Aye. Motion to execute the County Children and Youth Service Social Service Program Certification Statement for a period of 1/1/25 through 3/31/25 on behalf of the Children and Youth Services. Motion.
Second.
Motion is second. All in favor? Aye. Motion to execute the Office of Children, Youth, and Families Family First Transition Act invoice claim for the report period of July 1st, 24 through March 31st, 25 on behalf of the Children and Youth Services. Motion.
Second.
Motion is second. All in favor? Motion to execute the purchase of service agreement between Drug and Alcohol Rehabilitation Services, LLC, and the County of Pike on behalf of the Children and Youth Services. Motion.
Second.
Motion is second. All in favor? Aye. Next item is, we have miscellaneous, which is, as every meeting, the Penn State extension of calendar of events for everyone to review, and that moves us to press and public comment. We do have our sheriff here. Sheriff, did you have anything you wanted to speak to us about?
I just want to make myself available if there are any questions on that contract. So.
Okay, thank you. Go ahead.
Melinda Michaels, Pike County Dispatch. I was wondering if there's any current plans or preparations in works for the country's 250th anniversary celebration next year.
There is.
There is.
So we are, in fact, it just was this morning, we have a bell made out of fiberglass was purchased or donated by PMVB. They made the donation to the state of $10,000. We have put out a request to the 3 school districts for each of the art departments to do a design of what would be put on the bell. We have one back. We're waiting for the other 2 schools to respond back to us. And then from there, that will be sent to PMVB, I believe. And then they will have a say on which one gets chosen. But then the final decision is made by Pennsylvania 250th. There is also discussion in Milford Borough to have a parade on July 4th, 2026 here in the borough, celebrating the 250th. All the municipalities have been invited. to participate. We have put in for a grant for that of $10,000, sorry, to help offset the cost because parades don't come free. And then I think the other thing we're going to do is there's a letter that we're going to send out to all the organizations in the county that already do events, whether that be Black Bear or you name and asking them that during 2026 if they can revolve their events around the 250th. There's no sense in reinventing a lot of things. They're already there. We can just ask them to do it, and then we would help them advertise that, promote it through ourselves, and also through Pocono Mountain Vacation Bureau, which is the organization that could do the best job of promoting it. So that's where we are right now.
Thank you so much.
Okay. Anyone else?
If the grant doesn't fly, you don't get the grant, and the public donate.
There will be an opportunity for also, the grant more than likely will not cover all the expenses. And there will be an opportunity then for sponsorships, yes.
Thank you, Commissioner.
Yeah. Anyone have anything else? You're on.
All right.
10 states in the
I
house.
never did that before.
It's okay.
I came in late and I'll tell you why, so then you'll know. So my name is Jennifer Mercero. I'm with Penn State Extension, and thank you again for having me. When I started here over a half a year ago, I decided I wanted to bring more in-person programming back. And I'm pleased to say today we had our first in-person event. It was called Eating Healthy on a Budget. Teaches you how to shop and avoid the pitfalls of the store. I have Mary Ann Hubbard with me. She's one of my council members in Pike County. She's been instrumental in meeting with me and saying, hey, this is what we could use in Pike County, both in Milford and closer to where we live in Newfoundland and Greentown. So Chrissy came, she taught us how to get in the store and, sort of avoid the areas that you do spend more money that are, higher in sodium and things. And she gave out a financial calculator, what the money you're saving when you cut that out of your thing. She's having a bunch of online programs. I encourage everyone to visit extension.psu.edu for some of the online programming, and we're always open to suggestions for more in-person. And then one final thing, June 21st, we will be at the Music Fest, so thank you to the commissioners for helping guide us in getting space there at the Milford Community House. We will have all of our program and some educators on hand. So thank you again for your support.
Where was the event today?
The event was over at the Milford Community
Good.
House. The educator loved it and encouraged us to have more events there. So we are open to suggestions if you would like to send me an email. Okay. Thank you so much. Appreciate it.
Anyone else? Okay. Motion to adjourn.